Although Omicron may be just now peaking in some parts of the world, the latest figures show that in the U.S. and Canada, it is declining in cases. That's according to this chart by the New York Times, which combines data from Johns Hopkins and state and local health agencies. But with the United States still averaging more daily cases than at any other time in the pandemic, Dr. Fauci is warning Americans not to let down their guard. When it comes to vaccine hesitancy, new data shows Black Americans' hesitancy is falling faster than that of whites. According to a study published in the Journals of the American Medical Association, vaccine hesitancy among Black participants fell from 38% to 26% between December 2020 and June 2021, while the rate for white participants only fell 1 percentage point from 28% to 27%. That comes as CDC studies now confirm that booster shots strongly protected many against severe illness from COVID. Earlier today, I got a chance to sit down with White House Coronavirus Task Force member Dr. Cameron Webb to get all the latest on COVID. Dr. Webb, thank you for joining us tonight. Omicron seems to be waning a bit in some cities, some regions of the country. Where do you think we are with the Omicron variant and whether or not it has peaked or not?
Well, Charles, some of that depends on where you are. In some communities, we have seen that it looks like cases are starting to decline. In other communities, we're still seeing upticks. And I think some of that, it varies. And so, if you look nationwide, it looks like cases are starting to come down somewhat. But we say that with some caution because it still requires that ongoing commitment to mitigation, the ongoing commitment to wearing masks, to avoiding crowded places, to getting tested, and to making sure that you have your fullest level of protection with the vaccines to keep those case numbers coming down.
The majority of Black people in this country still live in the southern states. What is the picture of Omicron in the southern states, and what do you predict going forward for those states?
Well, in some of the rural communities in some southern states, we've seen there's a little bit of a lag. So they hadn't seen the same level of uptick in cases as early as we saw in more urban spaces, but we're starting to see that uptick. One thing that really stands out to me is that in a lot of these same communities, we've seen a real uptick in cases in the Black community specifically. And if you look at what's driving the real increase in cases, if you go back to the late summer, early fall, the rate of cases in the white community was higher than the rate of cases in the Black community nationally. And that flipped just after Thanksgiving. It flipped in this context of Omicron, and you've seen the uptick in cases as we headed into the end of the year. And it was driven by some of those southern states, Alabama, Arkansas, North and South Carolina, Tennessee, Texas. And so in those states, it was driven by 18 to 39-year-olds. That's where we're seeing the biggest uptick in cases or overrepresentation of COVID cases per population. And so what it tells me is that these are populations where we have lower rates of booster vaccination, and these are populations where folks weren't using the same level of mitigation strategies that we saw in some other parts of the country. You put those two things together, and that's why we saw the uptick. So I think in that sense, it's concerning. It's always concerning when you have an uptick in cases, especially in folks who aren't fully protected, because you can have a corresponding uptick in hospitalizations and sadly deaths. And so that's what we're trying to prevent and making sure that message gets out there.
There was an interesting piece in the Washington Post. It was written by Dr. Oni Blackstock, the executive director of Health Justice, and it said that vaccinated people of color appear to experience breakthrough infections at a higher rate than white people. Is that something that is borne out in the data that you have seen?
Not entirely, but I understand exactly where Dr. Blackstock is going with that observation. And one of the things Dr. Blackstock said in that piece, and has said in other spaces as well, is that we don't have the level of granularity in our data that we would like to see that will allow us to really track breakthrough infections by race and ethnicity. That designation as a breakthrough infection held a lot of value for us a couple of months back. I think Omicron has kind of broke through the ceiling on what we mean by a breakthrough infection at this point. Because if you've had one shot or two shots, you're still not fully protected from Omicron. We know boosters are your highest level of protection. So what would have been labeled a breakthrough infection earlier on no longer is. What we've learned from the science is that that protection starts to wane at some point in time. So it does kind of change the dynamics a little bit, but we are seeing that we're seeing a lot of folks who've had 2 shots get COVID, and so they have to get that booster to get that full protection.
Well, the reason that we don't have the data that you're talking about is that the CDC itself stopped tracking these breakthrough cases in May. Was that a smart move?
Well, I think one thing that we always encourage is to collect as much data as we can possibly have. And so I think that, a smart move in a pandemic is to always make sure you have every bit of information that's useful to you. In terms of what CDC is tracking and what they're publicly reporting, those are often different. But part of the reason why they don't publicly report information is if it's not sufficient, quality of the data. One thing we found is by race and ethnicity, often there's a huge number of missing data points. So you don't have the race ethnicity collected for everybody in whom you have a breakthrough infection and the like. And so I think that's what makes it challenging. It doesn't always reach their standard of what becomes publicly reported. But I think that just the same, what CDC and what we continue to encourage our colleagues who are there to do is to make sure that they're collecting as much information as can be useful to us in this pandemic. And we know that infections, hospitalizations, that can be useful. Again, that was a really powerful conversation for us a couple of months ago. I think Omicron's changed that dynamic a little bit, and it's kind of updated our perspective to where we just need to make sure everybody has the highest level of protection, which in this instance is boosters.
Right. So let's talk a little bit about these vaccinations. Ohio State University published a report today that said that hesitancy rates for Black people have now fallen to the point where they are comparable to hesitancy rates of white people, but Black vaccinations rate continue to lag. Should we now shift back to the conversation more focused on kind of access if the hesitancy is the exact same at this point?
As far as I know, certainly I haven't seen the specific study that came out today that you're referring to, but I disagree somewhat with the premise. So what we know from the National Immunization Survey, which is the largest nationally representative survey of vaccination rates, it tells us that our vaccination rates among Black, white, and Latino adults are effectively equal, all around 81, 82%. That's been the case since September. I think almost every major survey or outlet has come to the same conclusion, that our vaccination rates among adults with 1+ shot are about equivalent. We've closed those equity gaps. And so that's the first thing that I would say. When it comes to talking about vaccine confidence, addressing some of the hesitancy, what I would say is that varies. If we're talking about boosters, if we're talking about pediatrics, we still do see some of those challenges and concerns. I think that it's not always to say that it's identical among groups, that hesitancy has disappeared. I think it's the way that different groups talk about it to some extent. But I think we always have to focus on access, going back to your question, and that's the reason why we have vaccines in as many places as we do. It's not as simple as saying confidence is no longer the issue, therefore it must be access. There are other dynamics as well at play. And I think that for people, what's really most important in community is make sure that you're asking that question, especially at the point of care. Those trusted local messengers, oftentimes the healthcare professionals that those same individuals interface with, asking the question of, are you ready to get vaccinated? And if yes, what's holding you back? Those are the things that allow people to make a plan to get vaccinated. It's kind of public health 101. And so I think it's just continuing that process, engaging those health professionals, making sure they have the resources and have the vaccines, because the vaccines are widely available at this point. It's more a matter of making sure that some of those other dynamics are accounted for as well.
Dr. Webb, thank you so much for your time. I really appreciate it.
All right. Thanks so much for having me.